Understanding uterine fibroids. Uterine fibroids, also known as leiomyomas or myomas, are benign, non-cancerous, growths of muscle and connective tissue that develop in or on the uterus. These growths are often common and can vary widely in size and number. While many women with fibroids experience no symptoms, others may face significant challenges. Types of fibroids. There are three primary types of uterine fibroids, each with its own characteristics. Intramural fibroids. These are the most common type, growing within the muscular wall of the uterus. Submucosal fibroids. These protrude into the uterine cavity and can cause heavy bleeding or infertility. Subserosal fibroids. These grow outward from the uterus, often into the pelvic cavity. Some subserosal fibroids may become pedunculated, meaning they have a stalk-like attachment to the uterus. Causes and risk factors. The exact cause of uterine fibroids remains unknown, but several factors are thought to contribute to their development. Hormones, estrogen and progesterone, the hormones responsible for regulating the menstrual cycle, play a significant role in fibroid growth. Genetics. A family history of fibroids can increase your risk. Obesity. Excess weight is associated with a higher risk of fibroids. African American ethnicity. African American women are more likely to develop fibroids and experience more severe symptoms. Early puberty and late menopause. These factors can expose women to longer periods of hormone fluctuations. Symptoms of uterine fibroids. While many women with fibroids experience no symptoms, common signs and symptoms include heavy menstrual bleeding. This can lead to anemia, fatigue, and weakness. Pelvic pain or pressure. This may be felt in the lower abdomen or back. Frequent urination. As fibroids grow, they can press on the bladder. Painful intercourse. This can occur if fibroids interfere with sexual activity. Infertility. In some cases, large fibroids can affect fertility. Miscarriage. Fibroids can increase the risk of miscarriage. Diagnosis of uterine fibroids. A healthcare provider can diagnose uterine fibroids through a combination of physical examination, pelvic ultrasound, and sometimes additional tests, such as MRI or hysteroscopy. Treatment options. The appropriate treatment for uterine fibroids depends on the severity of symptoms, the size and location of the fibroids, and the patient's desire for future fertility. Treatment options include observation. Small, asymptomatic fibroids may not require treatment. Medications. Hormonal therapies can help manage symptoms and may shrink some fibroids. Nonsteroidal anti-inflammatory drugs, NSAIDs, can alleviate pain and reduce bleeding. Myomectomy. This surgical procedure removes fibroids while preserving the uterus. It can be performed through open surgery, laparoscopically, or hysteroscopically. Uterine artery embolization, UAE. This non-surgical procedure involves blocking the blood supply to the fibroids, causing them to shrink. Hysterectomy. In severe cases or when future fertility is not desired, a hysterectomy may be necessary to remove the uterus and fibroids. Lifestyle modifications. Certain lifestyle changes can help manage symptoms and may reduce the risk of fibroid growth. Weight management. Maintaining a healthy weight can reduce the risk of fibroids and help manage symptoms. Diet. A balanced diet rich in fruits, vegetables, and whole grains can support overall health. Exercise. Regular physical activity can help manage weight and improve overall well-being. Stress reduction. Techniques such as meditation, yoga, or deep breathing can help reduce stress and promote relaxation. Conclusion. Uterine fibroids are a common condition that affects many women. While they are generally benign, they can cause significant symptoms and impact quality of life. Understanding the causes, symptoms, and treatment options can help individuals make informed decisions about their healthcare. If you are experiencing symptoms associated with uterine fibroids, it is important to consult with a healthcare provider for proper diagnosis and treatment.